I'm Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. Today is November 19th, and this is our weekly COVID-19 update. And I'm going to let Julianne and Dr. C introduce themselves.
Hi, everyone. I'm Julianne Van Loo, the Director of the Health Department for Wyandotte County.
And I'm Dr. Corriveau. I'm the Deputy Health Officer for the Wyandotte County Public Health Department.
All right, so today we're going to talk about this new health order for COVID-19 precautions that came out at the beginning of this week and goes into effect tomorrow, the 20th. So I know that a lot of people are wondering why this was put in place, what exactly it covers, and what that means for people who live or work in Wyandotte County. So Julianne, can you give us a quick summary of the order?
Absolutely. Thanks, Janelle. So the order has two primary components. The first component is a 50% capacity limit on various venues. And those venues include entertainment venues like auditoriums, cinemas, stadiums, sporting venues, as well as recreational facilities. So we're talking gyms and fitness centers, amusement parks, bowling alleys, water parks, and then other just kind of informal gatherings, lectures, meetings, where you'd have a large number of people coming together. So all of those venues would now be subject to 50% capacity based on their capacity as written by the fire marshal. An additional element there for bars and restaurants in particular is that there is a 10 p.m. closing time for those institutions. And that's really because we know that those are types of venues where people are taking off their masks for eating and drinking, putting folks at particularly high risk, exerting themselves during physical activity, screaming, all of those things add to people's risk. And those are venues where people need to be well spread out and where a capacity cap can really help. The other element of the order is a 10-person limit on informal social gatherings. So this would be, families getting together for parties and celebrations, anything that's out at kind of recreation centers that's an ad hoc social gathering. We really need to limit those. The majority of our cases right now aren't really coming out of businesses and schools. They're coming out of these informal social gatherings. And so we're hopeful that that 10-person limit can really help to curb those situations.
Thank you. Now, so we know what the order is, but why exactly is this in place and why is this important? Dr. C, can you talk more about that?
Sure. Thanks, Janelle. Well, unfortunately, our hospitals are still really struggling for capacity. And it's not so much that we don't have enough beds physically in the hospitals. We just don't have sufficient staff to care for the patients who are coming in. So whereas we do have a lot more COVID patients than we did, a couple months ago, we are also having issues with our staff. Unfortunately, they are getting ill, and it's also just a case where we're hoping that we can keep those ratios safe, for the people who are in the hospital. We don't see that there's spread within the hospital itself. We have great measures in place while folks are in the hospital working and stuff to keep them safe and to keep the patients safe. But what we are seeing, unfortunately, is that there's a lot of sick people in the community, and some of the people who are working within the hospitals are themselves getting sick in the community and then are unable to work. And so these orders are in place because we're trying to preserve that capacity for folks who may have COVID or other issues. We don't want people to not have a place to go should they have trouble with their heart or their lungs or other medical problems. So that's the main reason we think that this is important.
Yeah, well, I don't know about you all, but I've been getting a lot of questions about this order since it came out. I think that there's still some confusion about it. So let's run through some like a Q&A of some of the questions we've been getting. So one question we've been hearing is what things fall under the 50% capacity rule and what things fall under the 10-person gathering limit rule? Julianne, can you talk about that?
Sure. So any of those venues that I mentioned where they're routinely holding public groups in large numbers, obviously bars and restaurants are very clearly defined, but any other kind of recreational gathering place is subject to that 50% limit. Now, those more ad hoc gatherings, those smaller gatherings that often happen, in people's communities, in their neighborhoods, in their homes, those are subject to the 10-person individual limit. You know, we've gone with the 50% capacity in those other venues in large part because people can be appropriately spread out. They can have a safety plan in place. They can be requiring mask wearing. There's someone responsible. There's a point of contact in those businesses and in those venues that's responsible for implementing these safety measures. And then the 10-person in-person gatherings are really just more those, again, those family situations where it's incumbent on everybody to take responsibility. There's really no business owner, you know, in those informal social gatherings. But we need them to stay small to mitigate that risk just among family and loved ones.
Yeah, thank you. Dr. C, I know you work with schools a lot in our area. Does this new order affect schools?
That's a good question, Janelle. I think to some extent it does. It certainly reinforces that we want mask wearing all of the time, you know, when students and staff are either at school or teaching or serving our students. We did actually put out a new school order that came out just before this sort of larger community-wide order that gave schools the option of having in-person learning. As long as the students could be properly distanced from one another at all times, and that would be the 6-foot distancing, and of course they would be masked at all times and such. We're still really feeling as though that cohorting method that we've talked about previously, we feel like that's really important to keep our students and staff safe, and so we continue to work really every week and throughout the weeks with our superintendents and with our school nurses to keep our students safe.
Okay, so in schools, the capacity is based on the square footage to be able to have that social distancing and not necessarily on the 50% mark.
That's correct. Thanks for that. Yes, that's absolutely right. So it's based on the space. So for instance, if a school had a really, really large space where they could educate their students, they may be able to bring in more than 50% of that specific room's capacity. However, if they had a smaller space, you know, they may not be able to bring in more than 50% and may even have less. So it's all based on how those children are able to be spaced apart from one another.
Yeah, and that last point on sometimes being less than 50% would also apply to other places because everywhere that social distancing should be maintained.
That's right. You know, another thing that is within this order, there's actually a small recommendation in there as well that, you know, if folks can work from home, and I'm thinking just in terms of the school, you know, for instance, if there's the ability to have a meeting, you know, with staff or administration, but this would apply to, you know, schools, businesses, really anything, you know, our own Thanksgivings with our families. If we can do that electronically right now or remotely, that would be extra wise, I think.
All right, gonna jump back to another point of confusion on the order. So something that we've been asked about is there's this new requirement for restaurants and bars to close by 10 p.m. Julianne, can you tell folks why that is? Why 10 p.m.?
Absolutely. So to begin with, bars and restaurants are already places of high risk, right? So you have to take off your mask to eat or to drink something. There's really no way around it. So it's a place of higher risk. We know that when people become inebriated, and people often do later into the evening, the later that they stay at a bar, people make oftentimes poorer decisions just because their judgment, their decision making is impaired due to alcohol. So there's that piece to factor in as well. And thirdly, we're really trying to get a bit at our younger demographic here. So actually in Wyandotte County, our age group of 20 to 29 is actually our highest number of cases across the entire county. So yes, oftentimes our older demographics end up sicker, but right now it's our younger demographics who are really likely some of those super spreaders who are taking it home to their parents and other family members. And so we really need to try to get harder at that younger demographic, have them stay home a little bit more, socialize in smaller groups. And so limiting some of that bar activity, we hope will help with that.
So Dr. C, to kind of wrap this up, what would you say about when people are considering what to do for their holiday gatherings and holiday celebrations this year?
Hmm. Well, I think that's on everybody's mind, you know. First of all, I want to say let's practice caution. Unfortunately, it's not just our region that's having a really hard time with hospital capacity and with really high numbers within the community. You know, it's a lot of communities, especially in the Midwest, but all over the country as well. We do not recommend that families travel this year, and in fact, I think the best recommendation is to stay within your own immediate family who you live with, and celebrate with those people only. You know, if you do go out and see others, if you can wear masks and you know, ask the other folks who you're visiting to do the same. And outdoors is always better than inside. You know, we would recommend that. Certainly, we cannot be gathering with more than 10 people together. And so these are all restrictions, but there are also fun ways to do Thanksgiving. You know, food delivery is okay. You know, making your neighbor or loved one a plate of food and delivering it to them, and then following up with a loving phone call, you know, that is all encouraged, you know. So we absolutely want you to share time with your family this year, but just to do that safely. You know, we also recommend sharing recipes, sending cookies if you can't travel, you know, those will keep, you know, in the mail for a few days. And so again, showing love towards your family, but also keeping them safe is going to be extra important right now. I mean, the level of spread right now in our community is unfortunately very, very high. Of course, one more point is we have our testing facility open, and so if you just absolutely cannot stay home or are not willing to do that, you know, we would rather test you before you go spend time with your family, so that you can know your status. You know, as Julianne alluded to, there are a lot of asymptomatic cases, you know, especially in our young people. And so we encourage all of you to come out to the Kmart at 78th and State, and we will test you for free prior to your holiday gatherings.
All right. Well, thank you so much for this discussion today. I just want to remind folks that if they want to see this health order or any of the latest COVID-19 data for Wyandotte County, they can go to wicokck.org/COVID-19. We'll see you next week.
Thank you.
Thanks, guys.